coworkers' tires following their breakup, but the charges were later dropped. Baldwin knows something isn't right, as the hospital has turned Anna's case into something bigger than it's supposed to be, believing they're even covering up causes and evidences. At first they think it's about money, but there may be something darker going on. The hospital board calls the entire staff to a meeting to tell them how the police are investigating a particular case involving one of their patients. The hospital's attorney, Mr. Beatty, tells the staff that he will be interviewing everyone and that patient discretion should be the #1 priority. If anyone decides to talk to the police without having someone from the hospital's administrative staff present, they may even lose their job. Baldwin and Braun talk to the prosecutor, who tells them that Linda should be present at the interviews and that they should not specifically ask about medications, something the detectives are not happy about. Baldwin doesn't understand why they should investigate something that the hospital keeps so confidential, but the prosecutor tells them they should still do it. Amy is seen by Linda and the detectives for the interview, confessing that Anna was her patient and that her loss was also very sudden. Linda is called out and the detectives take the opportunity to ask Amy about some deviation in Anna's condition, and she notes how her blood sugar values were wrong. She explains that the insulin in her system wasn't made for her body, so someone had to give it to her from outside. That would result in a double medication error, which is unusual and may have been the cause of Anna's loss. Upon Linda's return, Amy is asked about her coworkers, specifically Charlie, but Amy tells her that when Anna's situation happened it was the day shift, and Charlie and she work at night. Amy defends Charlie by praising what a good nurse he is and leaves. Now Amy is in the middle of a complication with one of the patients and it overexerts her heart to the point of almost fainting. Charlie finds her out of the way and gives her a pill using his nurse code at the hospital's computer, sitting down next to her. She says that he can be fired for using hospital medication without permission, but he tells her that he knows how to break the system so no one will notice. After another consultation with the cardiologist, Charlie tells Amy that she should talk to her daughters in case the worst happens, but Amy is scared as her daughters have no one else to be with. Charlie tries to cheer her up by telling her that there are only 2 months left before she can have insurance, so Amy decides to talk to Alex to explain the situation.